So thank you so much for your time. My name is Dr. Rujuta. You did a good job with that one. It's a tough name.
Thanks.
I am a physician at Women and Infants Hospital. I'm here on behalf of ACOG, like many of my other colleagues are. And I'm here in opposition of the House Bill 7735, which would make a felony of any person encouraging or aiding to contribute to the transportation of a child under the age of 18 across state lines for an abortion. So in an ideal world, if a young woman gets pregnant, she would have a close family, a positive relationship with her parents, where she could go and confide in them and ask them for their help, and then together they make a decision on what is the best next step for her. However, we don't live in an ideal world, and unfortunately, what happens for a lot of these minors is that they have legitimate fears that they will be physically abused or ejected from their homes if their parents found out that they were pregnant. Among minors who did not tell their parents about an abortion, 30% of them had experienced violence in their family or feared violence. Rhode Island already has one of the strictest parental involvement laws in the country. There are institutions like the American Medical Association and the American Academy of Pediatrics that do not endorse parental consent for abortion procedure because it unfortunately actually increases the risk of harm to the adolescent by delaying the access to appropriate medical care. So if we pass this bill, it would tighten Rhode Island's restrictions even further, making any person, including a grandmother, an aunt, an older sibling, or a healthcare provider, helping assist a minor to travel across state lines, a felon. So if you can imagine this hypothetical situation, you have a father that commits incest against his daughter, and that daughter becomes pregnant. And a grandmother helps her seek an abortion across state lines. Then technically that grandmother is now considered a felon and would be placed in jail. And in the most dire of circumstances, if that young woman still wanted an abortion, then she's going to seek that procedure in an illegal fashion or create a self-induced abortion. So what we're resulting in there is an increase in medical complications for this particular person, and that may even result in death because of, like we've heard before, these unsafe procedures that are illegally done can result in hemorrhage. So I think what's really important is that when you're imposing further barriers like this, you are going to increase the risk of minors delaying their care and health. You're going to increase the risk for medical complications. You're going to increase that some of these minors will be at greater risk for domestic abuse, and ultimately you're forcing this minor to carry a child against their will. I think it's really dangerous for our government to assume that, you know, we have healthy, open family communications and relationships just everywhere. That's not the truth. And I think by opposing this bill, we will still remember the rights of these minors also, and that this will be the healthiest and safest way for them to attain a procedure that they may need. Thank you again for your time.
Thank you, Doctor. Representative Vella Wilkinson.
Thank you very much, Mr. Chairman. Doctor, you do realize that in the state of Rhode Island that we do have an option for the child to go to the courts. So if in your scenario, if a child was being raped by a parent and went to the grandparent or to a family friend or whatever adult that she trusted, that they could still petition the courts and the child could get the abortion without the parental consent. You do realize that, right?
Absolutely, I do realize that. But if there are examples out there where children, minors, have gone to the court system and they have not been granted those rights, and then what you're doing, again, is that the whole process is being delayed. And when we talk about abortion care, the earlier that you are able to get an abortion, the safer it is. First trimester abortions are safer than colonoscopies. And the later you get the care, so let's say, okay, I'm going to go to the court system and I'm going to petition and I'm going to tell the court this is my scenario. That takes time. And unfortunately, in pregnancy, as the pregnancy progresses, then what you're doing is you're increasing the potential for medical complications for that patient.
Chairman, can I continue with a couple of questions? Thank you. So, Doctor, you alluded to the fact that there are children that are petitioning the courts for the right to have an abortion without parental consent, and they've been denied. Do you have those? Is that anecdotal information coming from you, or you have statistics?
No, I have, not on me right here, but yes, there are cases
In the state of Rhode Island?
No. I'm sorry, not specifically in the state of Rhode Island. I'm stating in general.
Okay, I understand, but this is a bill specifically for Rhode Island. So if you do have any data specific to the state of Rhode Island denying a child the ability to have an abortion outside of parental consent, I would definitely like to get those numbers. And just so that you know, I'm also researching that. Now, when an individual is going for an abortion, in order to have informed consent, for lack of a better term, the individual that's going to be providing the service will typically explain what the procedure involves. Are you telling me that a 10-year-old is capable of giving informed consent?
That's a difficult question that you're asking. I mean, I think the purpose of this law is that you still have someone that can help the child who isn't another 10-year-old, help them understand what's going on. And I think with this particular law, what we're stating is it has to be the parent. And what I'm saying is that circumstances and families are very different, and that may not be the best option. And this is limiting that 10-year-old to even go seek anyone that they could speak with about this condition or whatever they want to do with their pregnancy, because it'll become illegal for that person to help them.
So I've had conversations with professionals with regards to this bill, and I understand the concern over the advice making this bill too broad. And I have no problem with tightening up that language. As a matter of fact, I don't know if you were in the overflow room or if you were in here. When I introduced the bill, I had said that I would be working on tightening the language so the focus is the transportation of the youth. But I'm going to say to you again, and I understand that you're saying that it's difficult to discern whether or not a 10-year-old is capable of informed consent. But we've had another incident in Newport today of proof that there are children that are being used for sex trafficking. This isn't the first incident of that. My concern is that we are putting our young children at risk. Young children, and I'm even younger than teenagers, at risk. If you have an adult male that has a lascivious appetite for sex with young children, impregnates them and brings them across state lines, and the child is already terrified of the person who's impregnating them and bringing them across state lines. It's already happened to the tune of approximately 36 times a year in the state of Rhode Island. These kids are being brought across the state line to Connecticut. My focus, again, hold on one second. My focus is to protect those children. Now, again, if it's teenagers, and as I had said to Representative O'Grady, if it's a teenager, if it's her girlfriend who's bringing her, it's the boyfriend that's bringing her, that's not what I'm looking for. For me, it's the idea of protecting vulnerable youth from an adult who's taking advantage of the power dynamic to have sex with this individual, bring her across state lines for an abortion, could be doing it over and over again.
I, in no way, would condone that. However, I do have statistics from the Connecticut Department of Health, and within the last year, ages 12 to 16, there were 0 females brought from Rhode Island to Connecticut to have an abortion.
Right, that was in the last year. That is correct.
In the last year, right. So,
but I'm with you with that, okay? I understand that. But I will say to you again, because I spoke to the lawmakers in Connecticut, I was physically in Connecticut, not over a phone, not looking at data. And I was told that in 1992, this law was specifically crafted in the state of Connecticut because they believe the rights of the individual supersedes everything else. And I'm here to tell you, ma'am, and I respect the fact that you're here and you've waited so long to testify, truly. But when you have a state who's made the decision that if you're old enough to achieve puberty and then get pregnant, that you should have the ability to have an abortion without speaking to your guardian or your parents, there's something inherently wrong. And I believe that we, as a state, made the decision to require parental consent. This is a loophole in that law, and I'm looking to protect those 36 kids. We have an ability for them to petition the courts in the state of Rhode Island and still have that abortion without parental consent. We have that ability here. I just don't like the idea that we could be aiding and abetting sex traffickers with young children across state line. I just don't, I can't tolerate that. So I guess what I'm saying is you and I will both look at the stats, okay?
Right. I agree with you.
So that's fair. Thank you. Thank you, Chair.
Okay, anything, yes, Vice Chair Agello.
Doctor, if a medical professional, a person working in a Planned Parenthood clinic or other clinic that provided abortions, suspected from talking to the patient or the possible patient that this young female were being trafficked, were a sex slave, or was a victim of incest. Would it be the clinician's responsibility to report that to the appropriate authorities?
For pediatric patients, yes. It absolutely would.
Thank you.